Let me first of all take this opportunity to introduce myself. My name is Dr. Jai Savai, and the reason why we are meeting today and taking this exercise and the session is to make you understand the fundamental basics behind what is wound, how wounds are classified, what are the different causes of wounds, and we will also deal about the wound healing process. Now I'm sure you all are well aware that very soon we are going to launch one of the important breakthrough product, that is Cadomer, which is nothing but Cadexomer iodine, which would be a mega launch for our company, which is meant for majorly the chronic exuding wounds. So I'm sure you all are very excited for this launch. So it is important that we all should understand some of the very fundamental basics behind the wound, the basic anatomy, physiology and the pathophysiology behind the wound. So I request you all to undergo this session, to listen to this session very carefully, and you can even go through this session multiple times so that whatever the basics are there with respect to the wounds, it is very clear in your mind, so that during the launch it would be very easy for all of us to be on the same platform and to understand the advanced wound therapy options. So just to start with, what are the basic slides that I'll be covering? The session, today's session would be on basic skin anatomy, what are wounds, how wounds are defined, what are the causes, classification, some of the tricky terminologies, and about the wound healing process, the mechanism, the phases, and what are the factors affecting wound healing. So let me just start with the anatomy of the basic skin. As you all are aware of human skin, it is the outer or the external covering of the body which gives protection to our body. It is the largest organ of the body. Approximately around 20 square feet is the surface area. So if you look at the diagram over here, you can clearly see the anatomy of the skin, which is primarily been divided into three primary layers. The external layer or the outermost layer of the skin is called as epidermis. The word is so called, why? Because epi means external or above, and dermis means it is present above the layer dermis. It is the external covering of the skin which is giving you a waterproof jacket actually, and it also acts as a barrier to the infection. The next layer is actually dermis, which is present just below the epidermis. It is the thickest layer of the skin, and there are some of the important organelles which are present in this dermis, namely the sweat gland, which produces sweat, and it helps in temperature regulation of the body by producing sweat, which helps in cooling down the body. In addition to it, there are some of the important oil glands which are present, okay, which is attached to the hair follicle. This oil gland produces oil which helps to keep your skin layers moist as well as oily, and it has also multiple antimicrobial agents which will protect your skin against some of the pathogens. In addition, it has also called the hair follicle, and also you can see the red color and the blue color, they are nothing but the blood capillaries. So this is the layer of the skin which is richly supplied with blood and also the nutrients. The next layer is the subcutaneous or fatty tissue. This is the third layer. Now, of the entire total body fat, 50% of the body fat is found to be present in this fatty tissue, which is actually acting as a cushion to your skin. Now, with the help of this layer, the entire skin is actually attaching to the underlying structures like the muscle and the bones with the help of this fatty tissue. So if all in all I have to sum up the entire functions of the skin, different functions of skin includes protection, that is they help to protect your internal various organs, internal organelles, to protect them against some of the pathogens or disease causing organism. It also helps in temperature regulation by production of sweat, and you all know that vitamin D synthesis happens in presence of sunlight. So skin also plays a very important role in synthesis of vitamin D. So if there is any external injury or trauma to the skin, then its anatomy and its function would be interfered, causing wounds. So let us understand what is wound. How do we define wound? Definition of wound says any physical trauma compromising the integrity of the skin or of any tissue is said to be wound. So you can see clearly from the diagram, you can see that there is a minor cut in it, which is nothing but a small uncomplicated wound, but you can clearly see that the integrity of the skin is actually been disturbed. So if I have to give you a simple example, if I take a small pin and if I'll prick it on my skin, do you think it will be called as a wound? I am sure you will all agree with me that it is not called as a wound because the integrity of the skin is not getting disturbed over here. So when the integrity of the skin is getting disturbed, it is said to be wound. Now a wound will be a simple break like the diagram which has been seen above, the up end, and the diagram which you can see it below. It is nothing but a wound that is being extended deeper inside the layers of the skin, affecting the muscle, blood vessels, organs, and even some of the bones. So let's now understand how wounds are caused. Let's look at the causes one by one. Wound can be caused because of burns. So burns would include excessive heat, even electric shock, or even some of the chemicals like acids can cause wounds. Then animal bites. Best example I can quote is of a dog bite. If a person, okay, because of the dog bite, there is tremendous amount of pressure shear because of the teeth of the animal which can cause the wound. Then any physical trauma because of a road traffic accident, or if a person has fallen down from a great height, would suffer from serious injury which is called as a trauma. Surgery, even after the surgery, what a doctor does in the OT is the doctor would actually break open the skin with the help of some of the surgical instruments like scalpel. It will open up the skin and that would even cause the wound. So it is called as post-surgical trauma or post-surgical wound. Then comes pressure sore. Pressure sore is a type of a wound which is actually being caused in individuals in which there is prolonged hospitalization or immobility of, or if a person who is in coma, or the person is completely on bed rest for extended period for few months, then in that case you can clearly see from the diagram there are certain brown color spots which I am showing over here, wherein the skin and the bone are in so close proximity that there is too much of pressure that has been applied onto the skin, and the blood supply to those tissues, those cells would be completely cut off, the nutrient flow would be completely cut off, and gradually all the cells in those tissues will die, causing wounds. Then even certain metabolic disease like diabetes can even cause wounds which are called as diabetic foot ulcers. Now pressure sore or pressure ulcer and diabetic ulcers we will be dealing with in much more detail when we will be launching our product, that is Cadomer. So when we will meet one-on-one during the cycle meeting, we will deal with this chronic ulcers much more in depth and their pathophysiology. Now let us understand how wounds are classified. From a doctor's perspective, wound classification is very important because the choice of the antimicrobial dressing or any other wound therapeutic options or any other treatment, the choice would depend on how the wound is caused and what are the ways in which different wounds are actually present or it has caused in a human body. So there are different ways in which you can actually classify the wound. The first is etiology. The word etiology means causes. So we have already studied about what are the different ways in which the wounds are caused, like the wound is either caused due to diabetes or animal bite, or it could be because of physical trauma, or it could be because of surgery. So this is the way you classify the wounds based on etiology. Next is depending on integrity of the skin. Now this is a different type of a classification wherein you classify the wound depending on whether the wound is either closed or it is an open wound. Let's take an example of a post-surgical trauma or a diabetic foot ulcer or a physical trauma wherein the integrity of the skin is lost. So the wound is completely open. So those type of wounds are called as open wound. There are certain types of wound wherein the integrity of the skin is not lost, but the underlying structures are being affected, like majorly the blood vessels, small blood capillaries are being affected because of very high pressure that has been created, or a blunt force has been applied on the body, and that is the reason why the underlying blood capillaries beneath the skin would have damaged and there would be blood flow around the skin, and that is the reason why such kind of wounds, classic example is hematoma, which is an example of closed wound. Then wound depth. Wounds are even classified based on the depth of the wound. Like we have already studied about the anatomy of the skin. The skin has got three primary layers: the epidermis, dermis, and you have the fatty tissue. So which part of the skin is getting affected, whether it is epidermis, or it is epidermis plus dermis, or it is epidermis, dermis, and all the underlying layers and the structures are being affected. Depending on that, the wounds are classified either as superficial wounds, partial thickness wounds, or it is full thickness wounds. So superficial wounds would be majorly simple cut or abrasion due to rubbing or scratching would be classified under superficial wounds, because only the uppermost or the epidermis is getting affected. A partial thickness wound would be the one wherein the epidermis as well as the dermis of the skin is getting affected. The wound is present deep down into the dermis, and when all the layers of the skin, even the underlying structures like the bone, blood vessels and muscles are getting exposed, then in that case that kind of a wound is called as a full thickness wound. So most of the chronic wounds are actually example of full thickness wounds. Then doctors even have a tendency to classify the wounds based on morphological characteristics, whether that wound is actually showing any kind of discharge or not, whether there is pain or not, swelling or not, what is the wound base color. So they will classify the wound based on all the morphological features of the wound, and then they will decide on to what a therapeutic strategy they need to imply so as to quicken or hasten the wound healing process. The last way in which you can actually classify the wound is based on duration of wound healing. Now from a patient's angle and from a doctor's angle, it is very important that wound should heal on time. So that is the reason why time is an important factor by which you can actually classify the type of wound. So now let's understand, based on factor of time, how do you describe the type of wound? Majorly, the wound is actually being classified based on duration of healing as acute wound, as you can see from the diagram. The diagram which is shown over here is that of a very superficial wound, which is an uncomplicated or a minor cut which is only affecting upper layers of dermis and the epidermis. So what is happening over here? Such kind of wounds will heal in an anticipated time frame of hardly few weeks. Primarily, it would take around 2 weeks or 3 weeks time, and the wound will get healed automatically or naturally or by means of certain therapeutic strategies, in which way the wounds get healed very quickly. So in that case, if the wound is getting healed within few weeks, then those kind of wounds are called as acute wounds. Then there are certain kind of wounds which are called as chronic wounds. So you can see from the diagram and you can compare those two figures. The above one is the acute wound and the lower one is that of the chronic wound. So chronic wound are those wounds which fail to heal in an anticipated time frame and can even reoccur. So this kind of wound, the duration of healing is prolonged, that is beyond several weeks. It can even go beyond 2 weeks, it can go beyond 4 weeks, and even it will take several months to get healed. So you can see clearly from the diagram, a chronic wound is actually a type of a complicated wound wherein you can clearly see the underlying structures like the muscle and even the bones are getting exposed. So such wounds would take much time to get healed. It would take around several months to heal, and that is the reason why those kind of wounds are said to be chronic wounds. So if you look at the examples of acute wounds, a minor trauma, a minor cut or an abrasion, they are all examples of acute wounds. And examples of chronic wounds are pressure ulcer, venous leg ulcers and diabetic foot ulcers. And our product Cadomer is specifically indicated for the chronic wounds like pressure ulcer, venous leg ulcers and diabetic foot ulcers. So we would be dealing them with all these indications much more by and large when we will be launching our product. Now, let's understand what is the wound epidemiology based on the Indian study. Now, there was one study that was being undertaken which included the study both in the urban as well as in the rural population in India for wounds to understand what is the prevalence of wounds per 1,000 population. And it was been found that the prevalence of acute wounds was almost twice the number as compared to chronic wounds. So you can clearly see from the diagram, from the figure, is that per 1,000 of population, the prevalence is 10 people they suffer from acute wounds, and chronic wounds approximately half the number of acute wounds, which is approximately around 5. Now, if I have to further bifurcate what are the causes of this chronic wounds, if I have to look at this pie chart, I'll understand what are the causes of non-healing cutaneous wounds. That is, those are nothing but the chronic wounds which have affected deep down the layers of the skin. So if I have to bifurcate the chronic wounds, there are different causes of the chronic wounds, which majorly includes 58% of the patients suffer from diabetic ulcer, 16% because of trauma, 14% because of pressure ulcer, and 6% each because of the venous and arterial insufficiency ulcer. I am repeating once again, all the chronic non-healing cutaneous wounds we will be dealing with in much more detail during the Cadomer launch. Now, let's understand some of the important wound terminologies. So, it is very important for all of us to clear your concepts over here, because when we will be dealing with our Cadomer launch, there would be number of terminologies you will come across again and again, which are very important when you will be talking with the doctor or when you will be promoting our product. This kind of terminologies you will come across again and again. So, it is important for you all to understand and clear all the concepts with respect to the important wound terminologies. So, what wound terminologies I will be taking into consideration is what are the different types of wound tissue. Wound base color, the exudate, what is exudate, then how do you measure the wound. So, let's look at all these terminologies one by one. So, to start with, types of wound tissue, there are basic 3 types of wound tissue, namely necrotic tissue, second is granulation tissue, and third is hypergranulation tissue. Now, let's understand it one by one. What is necrotic tissue? Necrotic tissue is actually a very fancy term which is given. Necrotic tissue basically means it is non-viable, dead, and there is absolutely no blood flow to the tissue. So, what is this kind of a tissue? It is a tissue wherein the blood supply to that tissue is actually been cut off, maybe because of presence of infection, such that all the cells will be devoid of blood, will be devoid of nutrients, and gradually the cells and the tissue will ultimately die. So, you can clearly see from the diagram, you can see the yellow color patch over here, it is nothing but slough. So, what is slough? Slough is nothing but a type of a necrotic tissue which is yellowish, greenish, grey in color. It is lighter, thinner, and it is wet. And gradually, when this slough becomes more and more old, it becomes more and more dried, it becomes more and more thick, then it becomes leathery black in color. That is when that type of necrotic tissue is called as eschar. So, you can clearly see from this diagram that eschar is nothing but a black, brown, grey color necrotic tissue. Now, let's understand what do you mean by granulation tissue. Now, if I have to really compare necrotic tissue versus granular tissue, these are both the polar opposite ends. Necrotic tissue means it is a dead tissue, and a granulation tissue, it's a healthy tissue. So, it is actually a part of the wound healing process, that is the necrotic tissue is then replaced by the granulation tissue. So, your doctor will always await for this granulation tissue to be formed, which will mark the beginning of wound healing process. So, you can clearly see from this diagram, it is red and it is puffy colored, which tells you that there are a number of tiny blood vessels which are getting formed over here, and this blood vessels will actually ensure the blood supply and the nutrient supply to the tissues, so that the wound healing process will happen smoothly. Now, the reason why it is called as granulation tissue, if you look at the diagram, you will see that there are a number of regions over here which are raised above the surrounding fleshy tissue. Just because there are several bumps and it is wavy in shape, that is the reason why it is said to be granulation tissue. Now, there is a third type of a tissue which is called as hypergranulation tissue. Now, what happens is during the wound healing process, which I will explain you in couple of minutes, in couple of slides, what happens is that when the wound would heal, over a period of time, the wound healing, there would be deposition of proteins. The deposition of protein within the wound has happened so much that the deposition would actually have an outgrowth above the layer of the skin. So that you can clearly see from this diagram, that is called as an hypergranulation tissue, and this kind of a tissue would actually delay the epithelialization, that is the wound closure. Now, based on wound base color, even your doctor will identify which stage your wound is, and based on that your doctor will actually devise or will use a specific dressing option. So, you can clearly see from the first diagram, it is a healthy tissue which is a good blood flow, which is beefy red in color. If the wound is purple in color, then it will tell you that is actually there is presence of infection, there could be high bacterial load, and that could be because of trauma. If it is green in color, there are chances that that kind of wound will carry a non-viable tissue, and definitely there would be presence of any infection. If it is a white color wound base, then it will tell you that it is poor blood flow and it is macerated. Now, very important for all of you to understand what is wound exudate. What is exudate? Exudate is nothing but any accumulated fluids in a wound that is continuously oozing out from the underlying tissue. What does this wound fluid or the exudate contains? It contains nothing but serum. Serum is nothing but the component of the blood. Cellular debris. Cellular debris means very unwanted waste of the cells. Then bacteria, that is infection, and even leukocytes. Leukocytes are nothing but important first line defense cells. They are the soldiers. They are nothing but the white blood cells that will help to actually engulf or destroy some of the disease causing organisms like pathogens. So, what are the causes of this exudate? Any underlying infection, necrotic tissue and foreign objects will actually cause wound exudate. And this wound exudate is a challenging for the doctor because the selection of the dressing or the bandages would depend on the amount of wound exudate that is being produced or it is given out from the wound tissue. Now, it is very, very important that you understand how is the exudate assessed. So, there are two different ways in which you assess the exudate. First is type and second is the amount of exudate. So, based on the exudate type, the exudate is classified into 5 or primarily 4 different ways you can classify it. That is serous. If it is thin, clear, watery plasma, then it is called as serous. If it is bloody in nature, if there is blood also oozing out along with it, then it is called as sanguineous. If there is both watery plasma along with plasma, then it will be called as serosanguinous. And if there is thick, opaque, yellow-green color discharge along with, then it is called as purulent. Purulent exudate is nothing but when there would be pus oozing out from the wound. I am sure we are all aware about what is pus. I am sure we all have even seen pus. So, pus is nothing but a yellowish or a greyish color discharge which is primarily composed of lot of bacteria in it and also white blood cells which will be oozing out from the wound tissue. And purulent tissue or the exudate is a typical type of the exudate which will actually tell the doctor, yes, the wound is actually typically been infected. So, the therapeutic strategy, the wound dressing would automatically, he would change based on the type of exudates. Then exudate amount. How the exudates are actually being measured, it is based on what is the amount that is being secreted. So, what the doctor will do, he will apply any kind of a bandage onto the wound surface and then measure what is the amount or the area it is covering. Say for example, most of the acute wounds, when there is no discharge from the wound tissue, then in that case there would be none, that is wound tissues are completely dry. Scant, when wound tissues are moist and there is no measurable drainage. Third is small or minimal, when the wound tissues are moist and drainage is less than 25% of bandage surface. So what it tells you is that when the bandage has been applied onto the wound and when I take off the bandage, I will see that 25% of the bandage surface, you will see the exudate is getting absorbed. Then in that case, the exudate amount would be called as small or minimal. Moderate, when it is covering the 25 to 75% of the wound surface or the bandage surface, and it is called as large or copious when it is covering almost 3/4 of the bandage surface. That is when it is said to be large or it is exudingly very high. Now, wound measurements. How the wounds are measured by doctors? Firstly, doctor would measure the diameter of the wound from one edge to the other edge. That is, the doctor will measure the longest length and the longest width. This is primarily important because before the start of treatment and during the treatment, such kind of measurements will actually help the doctor to make a note whether the wound healing process is actually being progressing smoothly or not. Wound depth. They would actually use a cotton bud and they would insert inside the wound so as to measure what is the depth of that wound from the visible surface to the deepest area in the wound bed. Then the wound area. So they would measure the length as well as the width, and that's how they would measure the wound area. Then even they would measure the wound volume, that is by measuring the length, the width and even the depth of the wound. So all these measurements the doctors would do it, and gradually by making these measurements at regular interval, the doctor will have an hint that whether the wound healing is happening or not with respect to a particular dressing. So with this fundamental basic, now let us understand the wound healing process. What are the mechanism, phases and what are the factors actually affecting the wound healing. Now let's understand definition. What is wound healing? Wound healing is also called as wound repair. It is the body's natural process of restoring normal function and structure after injury. The entire wound healing process is actually a complex series of events that begins at the moment of injury and can even continue for several months to years. So you can clearly see from the diagram, you can see from the top figure that the wound has been created. In the second figure, you can see, second image, that wound is getting healed a bit, and in the third figure you can clearly see that the wound is getting completely closed. So that's how the wound healing process will actually happen. Now let's understand it one by one. What are the different phases of wound healing? Primarily, there are 4 phases of wound healing, namely hemostasis, second is inflammatory, third is proliferative, and fourth is remodeling or maturation. Let's look at it and understand it one by one. The first phase of wound healing is hemostasis. What does the word hemostasis means? Hemo means blood and stasis means stop. So if a wound is being created, what will happen? The first time, what will happen? Immediately when the wound is being created, the blood will continuously ooze out. So let me give you an example. If I have got a wound over here, do you think I will continuously bleed unless and until the entire 4 or 5 liters of blood which is present in my body, I will continuously bleed to depth? No. What will happen? There will be certain important cells like platelets, which are important cells which are present in our body. They will form a primary plug into the wound. That's how they will actually stop the bleeding that will occur from the wounds. So that is the first step, that is hemostasis, that will occur immediately. Later on, there is a second phase which is called as inflammatory stage. This phase will actually happen, and it will prolong from day 1 till day 4. Now what happens when there is wound that has got formed? There are chances that from the surrounding areas, all the disease causing organisms, bacteria, they will try to invade our body through the wound. So during this phase, all the important cells like the WBCs, like neutrophils, macrophages, they will rush to the wound surface and they will try to destroy all the bacteria and the invading microorganisms. So it will help to protect our body from getting any systemic infection. The next phase is proliferative phase. What will happen during this phase? During this phase, important cells like fibroblasts, they will migrate to the wound surface and they will actually help in filling the depth. So what will happen if the wound is such large, then in that case with the help of fibroblast, the wound defect will get filled in with the help of fibroblast. So proliferative phase is very important and it will go on from day 4 till day 21. The last phase is very important, which is remodeling. This phase will go on from 21 day to almost several months, or even it can take several years. So this is a phase wherein there is complete wound contraction. The wound is getting completely healed and there will be a scar formation. So that scar might remain for several months or for even several years. So in nutshell, if I have to explain you all the 4 phases, the first phase is the hemostasis, wherein there will be clotting happening because of platelets that will ensure that bleeding is stopped. During second phase, that is during the inflammatory phase, WBCs, they play a very important role that will help in killing all the pathogens which are trying to invade the wound by a process known as phagocytosis. That is, they would engulf the bacteria and they would destroy it. Then in the third phase, which is proliferative phase, fibroblasts, they play a very important role in filling the defect. And in the fourth phase, there would be wound closure and there would be scar formation. Now there is an interesting video which I am going to show you, which is actually an animated video. This video will actually help you to understand all the different phases of wound healing. All the 4 phases, it is been explained in the form of animation. So it will help you to understand that how wound healing actually happens.
The largest organ in your body isn't your liver or your brain, it's your skin, with a surface area of about 20 square feet in adults. Though different areas of the skin have different characteristics, much of this surface performs similar functions, such as sweating, feeling heat and cold, and growing hair. But after a deep cut or wound, the newly healed skin will look different from the surrounding area and may not fully regain all its abilities for a while, or at all. To understand why this happens, we need to look at the structure of the human skin. The top layer, called the epidermis, consists mostly of hardened cells, called keratinocytes, and provides protection. Since its outer layer is constantly being shed and renewed, it's pretty easy to repair. But sometimes a wound penetrates into the dermis, which contains blood vessels and the various glands and nerve endings that enable the skin's many functions. And when that happens, it triggers the 4 overlapping stages of the regenerative process. The first stage, hemostasis, is the skin's response to 2 immediate threats: that you're now losing blood and that the physical barrier of the epidermis has been compromised. As the blood vessels tighten to minimize the bleeding in a process known as vasoconstriction, both threats are averted by forming a blood clot. A special protein known as fibrin forms crosslinks on the top of the skin, preventing blood from flowing out and bacteria or pathogens from getting in. After about 3 hours of this, the skin begins to turn red, signaling the next stage, inflammation. With bleeding under control and the barrier secured, the body sends special cells to fight any pathogens that may have gotten through. Among the most important of these are white blood cells, known as macrophages, which devour bacteria and damaged tissue through a process known as phagocytosis, in addition to producing growth factors to spur healing. And because these tiny soldiers need to travel through the blood to get to the wound site, the previously constricted blood vessels now expand in a process called vasodilation. About 2 to 3 days after the wound, the proliferative stage occurs, when fibroblast cells begin to enter the wound. In the process of collagen deposition, they produce a fibrous protein called collagen in the wound site, forming connective skin tissue to replace the fibrin from before. As epidermal cells divide to reform the outer layer of skin, the dermis contracts to close the wound. Finally, in the 4th stage of remodeling, the wound matures as the newly deposited collagen is rearranged and converted into specific types. Through this process, which can take over a year, the tensile strength of the new skin is improved, and blood vessels and other connections are strengthened. With time, the new tissue can reach from 50 to 80% of some of its original healthy function, depending on the severity of the initial wound and on the function itself. But because the skin does not fully recover, scarring continues to be a major clinical issue for doctors around the world. And even though researchers have made significant strides in understanding the healing process, many fundamental mysteries remain unresolved. For instance, do fibroblast cells arrive from the blood vessels or from skin tissue adjacent to the wound? And why do some other mammals, such as deer, heal their wounds much more efficiently and completely than humans? By finding the answers to these questions and others, we may one day be able to heal ourselves so well that scars will be just a memory.
So with this video, I am sure the entire wound healing process would be very clear in your mind. So there are basic 4 phases. So how the wound healing happens gradually over a period of time, I am sure it would be very clear in your minds with this fundamental video, which is explain you wound healing very beautifully. So now let's understand what are the factors actually affecting the wound healing. Wound healing will get affected if there is any wound infection. If there is presence of bacteria or any other organism, then in that case what will happen, your phase 2, that is your inflammatory phase, which normally happens within 3 days or 4 days, it will get prolonged. So what will happen, your normal wound healing process will get disturbed and wound healing will get delayed. Second is exudate. What will happen if there is too much of exudate or too much of discharge from the wounded tissue, then in that case even your normal wound healing process will get interfered. What will happen? The epithelialization or the wound closure will get delayed, and in that case it will also tell you that because of exudate there is an underlying infection, because of which the wound healing is actually getting delayed by several days. Necrotic tissue. As I had briefed you earlier, what is necrotic tissue? Necrotic tissue is nothing but a dead tissue, a non-viable tissue, which is actually interfering the wound healing process, and doctor will always have to remove this necrotic tissue by means of surgery, by which it will help in actually helping the wound healing process further. Nutritional status. Now this is very important. Why? Because the important cells like fibroblasts, WBCs, leukocytes, they are nothing but cells of our body. Even they need important nutrients for them to grow, for them to perform their normal function. So if a person is not having proper diet, not having proper food, if the person is not getting proper nutrients, then in that case the functions of those cells will also get affected, and in that case indirectly the wound healing process will also get affected. Thereafter, immune system. Immune system is actually being taken up by all our important cells like the immune cells, which includes your white blood cells or leukocytes. So they play a very important role during the wound healing process, especially during the inflammatory, that is phase 2 during the wound healing process. So if a person has got weak immunity, the immune cells would not be produced, or they would be very less in number. They will not be able to fight with the invading pathogens, and in that case wound healing process will get delayed. So what is the goal of wound healing? So first and foremost, it is important for a doctor to treat as well as to prevent the infection, because this will ensure the normal wound healing process which will happen smoothly. Thereafter, the important goal is to repair the tissue in a timely manner. Third is to restore the function and the anatomy of the skin. Next is to minimize the inflammation and edema. Edema is nothing but collection of fluid. It is nothing but swelling that you see. Then minimizing the pain at the wound site, followed by best possible aesthetic outcome. So these are some of the important fundamental goals of wound healing. And if immediate treatment is not been done, because it is very important to treat the wound at an earlier stage, and if it is not done, then in that case it will cause complication. So wound treatment is very essential and becomes imperative to prevent complications. So basics in wound care management, we will be dealing it during our Cadomer launch, because soon we are going to launch our major breakthrough product, which is Cadomer. So whatever the indications per se with respect to the Cadexomer iodine, okay, we will be dealing with in much more detail, and also some of the important wound care management options, we will be dealing them with it during the cycle meeting when we are going to meet one-on-one and when we are going to launch this Cadomer product. So if you have got any particular query with respect to this session, we are very happy to help you, and you can mail us or contact us on this email ID. And I request you all once again to go through the session multiple times, so that whatever queries you have, maybe you can call us or you can jot it down, and then we can solve those queries when we will meet during the cycle meeting one-on-one. Thank you so much.